Hello, class. This is Edward Garcia. This is the program implementation plan assignment for clinical health program planning and evaluation from Towson University. The program that I have developed is sleep health program. This would increase the public knowledge of how adequate sleep and treatment of sleep disorders improves health, vitality, and just a quality of life by identification, intervention, and also the compliance of treatment. The program goals was to develop an understanding of the effects of sleep health issues in males over the age of 21 and educate the need for proper sleep. The idea actually came from knowing that I work off shifts as well during the weekends just to keep my clinical skills up and some of the effects that I feel after working those particular shifts. Then I said, well, how can we go ahead and make this a little bit more globally rather than just a niche? And so I thought about the ideas that I know all of us have seen those commercials on TV regarding Viagra and the other one, the other pill, whatever they have. And I said, well, you know what? That is a way to get to the adult male, especially for those who know they have a problem, they just don't want to quite admit it. So with that particular idea is how I, with that particular idea is how I developed this particular program. So the program objective number one was really determine how many adult males over the age of 21 are affected by sleep health issues. The process objective was basically having participation of at least 100,000 adult males in the first 6 months to an online questionnaire slash survey that would be developed on a website. The effect objective was basically from those 100,000 questionnaire surveys, a goal of referral is 30% of those who actually take the survey of 100,000, have 30 of those actually have a referral, with the understanding that at least 75 of those will actually follow through in visiting their primary physician or sleep physician. The objective number two for this program is to determine how acute and or chronic sleep health is among adult males. So the process objective was basically collect data from these 100,000 participants in the first 6 months to determine the baseline of acuteness and or chronic of sleep health. And so the effect objective was basically understanding what that is, or just basically determining a baseline. The continuum, of course, is the factors measured would include, but not limited to, hours of sleep per night, sleepiness during work, sleepiness while driving, amount of loss of days of work, and loss of work due to sleep health issues. The third objective was as well was to determine how sleep health preventative steps are influencing outcomes. So the process was obtain a follow-up questionnaire slash survey from participants to determine the impact of program of 50% of the referred participants in 1 year. In other words, we know we're not going to be able to capture everyone, but if we're able to capture at least 50% of those, then we would love to see what the the baseline compared to the baseline where we're at right now. And the effect is basically at the end of 1 year, have 50% participation of referred. So the implementation timeline really it stretches out because it just kind of needs a lot of participation from a lot of different people. And so just making sure that we have sleep physicians on board, pulmonologists, case managers, and identification of also the stakeholders. Perform the needs assessment, as you can continue reading on there as to what we're looking at. One of the things is really in kind of towards the 1 year mark is really where we want to launch our campaign after we do some definitely some homework in the website development and marketing, being able to get a good, nice looking commercial and just a call center set up. And so forth and so on. So even though this is a pretty aggressive timeline, we do feel that it can be possible given the need for sleep health knowledge in our community. So the estimated cost and potential funding partners is really this is what the cost you see on there as well. The website, web hosting, upkeep, as you can see, is about $100,000 a year just to keep that website going. The advertisement, the initial investment will be $250,000. Now that does not include prime time, and so we have to take that into account as well. If we actually, depending on how much funding we would get, depending on what slots we would be able to be able to manage. And of course, you continue going on with advertising and the call center staff, and whatnot. But the great thing is we've identified some really potential funding partners to get this program off the ground, because in all these particular funding partners, there is some sort of investment in health. And as you can see, American Heart, American Anesthesiology, American Lung, AARC, National Sleep Foundation, just to name a few that were really just the main focus. Now, of course, we can also go into the DME companies, and they definitely would be wonderful partners as well, as we will be referring a lot of those particular patients to these companies. So the program evaluation method was basically one group pre-test and post-test. The data collection will allow not to only understand the amount of individuals in the direct services program level, but also those affected once a program is complete. The data collected will include amount of adult males with sleep health issues, the acuteness and chronic, and also the effects that has had on their lifestyle. And of course, we definitely want to know what the post program implementation would be for that particular individual. So statistical outcomes expected is the evaluation increased public knowledge of how adequate sleep and treatment of sleep disorders improve health, vitality, quality of life, with intervention compliance with treatment. Data source would be survey data. The amount of participants in the survey needs of participation refers due to geographical area, determination of acuity and chronic. One thing I forgot to mention is on this website, we would love to have a smart Google geographical mapping, so that way, depends on where the survey was taken. If they don't want to call the call center, they definitely would be then guided to the closest um, primary physician or sleep center in their area, depending on where it is that they are filling in their survey. So that's just also another technology we could definitely use. And these are the references that I used. And so in a nutshell, I do believe that sleep health is very important to our society, and just a little bit of a program to even try to even launch it nationally and try to get some grassroots would be important as we continue to improve the health of our Americans. Thank you very much.